Welcome to the Psychogastroenterologist, the show where we explore the fascinating intersection of the brain-gut connection through a multidisciplinary lens informed by psychology, neuroscience, and gastroenterology, better known as psychogastroenterology. Our mission is to delve into the gut-brain axis and uncover how this powerful connection influences mental, physical, and overall well-being. Whether you work in behavioral health, healthcare, the criminal justice system, or health and wellness coaching, this podcast offers insights to inform and inspire your work. Join us as we break down complex concepts, share evidence-based perspectives, and discuss emerging trends in this rapidly evolving field. The information provided in this podcast is for educational purposes only and is not intended as medical or mental health advice. The content discussed should not replace professional judgment, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding any medical or psychological concerns. The views expressed by our hosts and our guests are their own and do not necessarily reflect those of any affiliated organizations.
Welcome back, everyone, to the Psychogastroenterologist podcast program, a podcast program offered through Pathways Counseling Center. If you're new to our podcast, please check out our other episodes. We're on episode 4 now. Today, we're going to talk about the topic of pediatric constipation. I'm your host, Dr. Jerrod Brown. If you're listening to this just audio, want to advise all of you that we will be having a YouTube channel in the near future so you can see the slides visually. But we'll talk about a whole bunch of things today. But if you have any questions, please reach out. My email address is listed on the slides and it's listed on our website. Here is a copy of my brief professional biography. Again, I'm a professor, trainer, researcher, and consultant. I've done a lot of work in the area of the gut-brain axis. One of my master's degrees is in nutrition. I've studied the gut-brain axis within the context of neuroscience, nutrition, behavioral health, and even neurocriminology. We're going to talk about all of these topics and many more on this podcast program. And if you can see this visually, and if not, don't worry, I'll walk us through it a little bit. These are some of my main areas of focus that guide and inform the work I do. I do a lot of trainings. I appear on other podcast programs, do a lot of consultation for various groups. And one of the big areas that does guide and inform my work is research pertaining to the gut-brain axis and psychogastroenterology. But beyond that, I have found it helpful to really understand when you're working on cases involving like complex human behavior. It's important to understand at least the basics of neuroscience, trauma, attachment theory. I've really found it helpful as well, understanding the first 1,000 days of life research. That's day 1 of conception all the way to age 2. And as you can see here on the slide, there's many more subtopics: lifestyle medicine, the central nervous system, metacognition, the prefrontal cortex. These are all topics we will be talking about in future episodes. Our agenda for today's program is very straightforward. I typically set up all of the talks in a similar format, so I'm going to give you a really broad spectrum overview on the topic of pediatric constipation. We'll have about 20 minutes today of just talking about these things. Just know that there's literally hundreds and hundreds, if not thousands, of studies that have been published on various aspects of constipation over the past numerous decades. So obviously, we're only going to be able to get to so much today. Part 2 of our talk today is all about implementation, helpful reminders. What do you need to know during an intake, an interview, a screening process? Everything I'm sharing today is for educational purposes only, but I think sometimes people ask themselves when they hear the term constipation, maybe you're working in the behavioral health field, maybe you're working in the criminal justice arena or some other helping profession. Yes, it's a heavy-duty medical topic, but folks that work in behavioral health, people that do trauma work, people that work with justice-involved populations, it is very important to understand at least the basics of constipation. Why do I say that? Well, a lot of your clients probably are dealing with constipation at some point or another, if we believe what the research says. Depending on the definition you look at, I just want to kind of give us a range. Pediatrics, you can find different definitions out there, but typically when I talk on topics related to pediatrics, I'm really covering from birth up until about the age of 18. A lot of what I'm going to talk about today, you can utilize and be aware of with adult populations, but obviously doing it in conjunction with a qualified healthcare professional, making sure you have the proper training and credentials and things of that nature. And then part 3 of our talk today is going to be all about tips, strategies, solutions, and interventions just from a basic educational standpoint. So when we get into the topic of pediatric constipation, the question comes up sometimes, well, why are you interested in that topic? And that's always a great question, because I've really gained a great appreciation for the interconnectedness between digestive health issues and brain-based and emotional problems through the work I've done over the years in the gut-brain axis. And one of those topics that does come up in this research literature is constipation. And I do want to say too, if you're interested in the topic of constipation, obviously the big focus today is on pediatrics, but I am putting together some talks for our podcast program coming up on how does constipation relate to folks who are diagnosed with schizophrenia? How does constipation relate to somebody that has migraine? How does constipation and trauma relate to one another? So those will be some episodes to be on the lookout for in the future if you really want to dig deeper in the weeds with the topic of constipation. So let's just get down to business here today. If you look at this particular slide, and maybe you're listening to this in audio format, constipation is a public health problem. It's common. It's a clinical issue. It's an educational issue. Why do I say that? Well, children, teenagers who are constipated going to school, that can impact attention, learning. It is a huge medical problem, and it might be partially related to a forensic and legal concern in some cases. I want to alert you to the term functional constipation. That's going to be the most common type of constipation. And this particular slide here, and at the bottom of each of my slides is my full citation. Functional constipation in children does impact a sizable minority of younger individuals. It places a heavy burden on the United States healthcare system. There's a small minority of people too. If you're working in an emergency room department, you're probably coming into contact with folks, I would say on a semi-regular basis, who are reporting to the emergency room because of abdominal pain and constipation related issues. And it's a huge issue as to why people go to their medical doctors as well. So that's another reason why we really want to become constipation informed. This slide here's got a lot packed in, but let's just unpack it a little bit. And I wish we had several hours to talk about this topic, but constipation, the signs and symptoms, if you look at the literature, vary. But what does constipation truly mean? Well, as you can see here, reduced bowel frequency. I think that's pretty common. We know that people are having less bowel movements, having difficulty with defecation. Constipation is related to hard, dry, or nutty stools. And I think part of the reason why we're doing this podcast program is to just kind of normalize these things, because it is embarrassing to talk about. It's difficult for clients to talk about these things. It's probably difficult in some situations for clinicians to get into the habit of asking clients questions about these things. But the more we can name it and normalize that, unfortunately, these things are all too common in clinical populations, I think the more we're going to be in a mindset to at least be aware of the red flag indicators, risk factors, and warning signs among the clients we serve who might be dealing with co-occurring constipation, and then providing them with resources, referrals to appropriate specialists, and maybe let's pretend you're a behavioral health specialist. There's a lot of interventions from a behavioral health lens you can use as well that can help your clients reduce rates of constipation in the future. So childhood constipation, why do we want to care about this topic? Well, a few things on this slide I think really sum it up. It does play a role in reducing the overall quality of life of that child, particularly if we're talking about chronic constipation where the child is constipated many, many days per week, week after week, month after month, and maybe year after year in some cases. Childhood constipation doesn't just impact the child. it can have a profound emotional, behavioral impact on caregivers. And another reason why we want to study this topic, it is associated with increased healthcare costs. So the more we can address this problem from a holistic and integrative biopsychosocial lens, working with a multidisciplinary team of professionals, it's only going to help the individual, family, and hopefully the entire healthcare arena. This slide here is a visual, again, just to highlight when we're talking constipation, it's typically divided into two different causes, organic causes and functional types. Functional types relate to about 95% of all constipation cases. Organic causes are about 5%. When I use the term functional, that's going to be more associated with problematic lifestyle factors, stress, worry, trauma. Maybe it's dehydration. Maybe there's some family issues going on. Maybe that child has learned behaviors where they're holding their stools and not going to the bathroom. Those are more functional types. This slide here highlights some of the potential organic causes for constipation. There's many, many more, but a few you'd want to be aware of. Celiac disease. We'll probably have an episode on that at some point in the future. Hypothyroidism, and there's many other things here. But visually here, you can see there's at least 5 different causes you'd want to be aware of. And another reason why that I think it's important for us to learn about constipation is because I think a lot of people in our field, behavioral health, mental health, criminal justice arena, and other helping professions, you get a lot of training on the adverse childhood experiences research. And this particular slide here indicates if you are working with people that have had an elevated level of adverse childhood experiences, so basically these are experiences of trauma that happened to your client before the age of 18, there is some evidence to support the fact that as that child gets older and a proper supports, services, and interventions were not put into place, that individual may be dealing with more bowel dysfunction, which would be one component would be constipation. And another thing, I just want to plant the seeds here. By no means am I saying this applies to every single child, but if you're working in the arena of serving children, adolescents, teenagers that have a lot of behavioral problems, could one piece of the puzzle be chronic constipation? While some evidence does support the fact that chronic symptoms associated with constipation may trigger or exacerbate behavioral problems. Again, there's a lot of other pieces of the puzzle we need to be aware of, like sleep issues, trauma, other forms of body pain, emotional problems. But I would definitely always dig into constipation as well. That could be a missing piece of the puzzle. And if you're working with children, and this slide here shows us visually, but if you're working with children who have a high degree of internalizing and externalizing disorders or problems, a good chunk of these children may be dealing with higher rates of constipation. Let's break this down for us. What is an externalizing problem? Well, externalizing would be something you as the clinician, professional, caregiver can see pretty easily. These would be children that have more behavioral problems, more emotional outbursts. These are things we can see. Internalizing problems might be a little trickier to see. This could be a child that has higher degrees of loneliness, sadness, these internalizing symptoms. Internalizing symptoms and externalizing behavioral problems, if gone unchecked, can contribute to higher rates of constipation, and vice versa. Higher rates of constipation can trigger more internalizing and more externalizing problems as well. That was a very broad overview for section 1 today, folks. So as we move into part 2 of our talk today, screening, interviewing, intake kinds of considerations you'd want to be aware of. So this slide here, really lovely article that breaks down just some different things qualified professionals would dig into when you are doing a comprehensive history-taking session with somebody that has constipation. Well, a lot of things you want to be aware of. And again, a lot of this you do in conjunction with a healthcare provider, but a couple things you want to be aware of. Well, when did the constipation first start? Depending on the child, obviously, you'd want to interview the caregivers involved. Is there some unexplained weight loss? Or is that child having difficulty gaining weight? Appetite control issues, nausea, vomiting, dietary history. What does the child eat? When do they eat? How much they eat? Fluid consumption habits. Are they consuming lots of dairy products? Sugar sweetened beverages? Are they having water? These are a few things just to dig into that may help piece together all the moving parts that could be contributing to constipation in that child. The symptoms of constipation can vary amongst individuals, and it really does depend too on how old the child is. Can they verbalize things? Well, constipation can lead to more body pain, more discomfort, more nausea, bloating, decreased appetite. In young children, infants, constipation, more sleep issues, more colickiness, things of that nature as the child gets older. Maybe again, there's some more behavioral problems you'd want to be on the lookout for. What are the causes for constipation again? Well, they're many and varied. Diet plays a role, sleep health, stress levels, fluid consumption habits, even genetic factors are at play in some cases. Maybe the child has slow intestinal movement. Maybe there's something going on medically that obviously getting some testing. High rates of sedentary behaviors can be a potential cause for constipation in some people. Some other potential contributors you'd want to be aware of if we're looking at this through a childhood constipation lens. Plenty of research says you really want to dig into. Maybe there's a history of trauma in some cases. So really having an appreciation for trauma and even fractured attachment patterns. Difficult temperament could be a piece of this puzzle. The child may have some temperamental issues, ruling out some emotional and behavioral problems. Maybe again, that child just doesn't consume a lot of fluids or they don't eat enough fiber. Maybe there's frequent temper tantrums. Maybe there's some bullying behaviors going on at school and that child is being bullied and teased, which is a form of trauma. There is research literature on all of these topics. Other potential contributors, I just have it broken down here visually for us as well. It's an easy slide to look at, but let's just talk about it verbally as well. The first one, inadequate hydration, not getting enough fluids, big factor. Number 2, not getting enough fiber. A low fiber diet could be a factor. Number 3, minimal activity level, so sedentary behaviors. If that child or teenager is on their screen for multiple hours a day, we're talking sedentary behaviors on top of that. And then if we have excessive screen time exposure, there is some evidence to show too, excessive screen time exposure may contribute to more unhealthy snacking behaviors as well. Number 4, slow intestinal transit. That would be an area definitely working with a healthcare provider on. And number 5, being aware of some of those behavioral factors that we spoke about just a few minutes ago. And if you're seeing this visually, you've seen this slide in other episodes I've done, but starting to move in that direction of really having an appreciation for the biopsychosocial model, really being aware of biological factors that could be at play, psychological and social factors. What are some of those factors if we look at it through a biopsychosocial lens? Are there any mental health challenges at play? Trauma histories, problematic lifestyle patterns? Maybe there's some problematic coping patterns at play. Maybe there's a full-blown gastrointestinal disorder. All of these things need to be dug into, and you can work with a holistic, integrative team. And the more we can understand these moving parts, the more we can help that child and their family address the issue of constipation. And equally important is if you see this visually here is when we're talking about functional constipation in children, the research literature really stresses the importance of conducting a comprehensive family psychosocial assessment. In a lot of cases, I'm not saying every single case, but potential contributors to childhood constipation could be found within that family system. Now, I'm not putting down any caregivers. I'm just saying maybe there's some problematic patterns in the family, looking at family eating behaviors, family exercise patterns, family stress levels, family economic status, things of that nature. All very, very important. The more we can look at all these moving parts, maybe the family doesn't realize that getting takeout every night is a contributor to their child's constipation. Just some general education to that family system could play a vital role in helping combat functional constipation. The research literature also really stresses the importance when you study functional constipation in children. In some of these cases, could there be some conflict going on between that child and the parent? Maybe there's some fractured attachment kinds of problems. Maybe there's some family communication issues. Maybe the parents are really stressed or burnt out. Maybe the family system, unfortunately, is going through a major loss or a divorce, or they're on the verge of homelessness. All of those things are huge stressors, and we know that chronic stress is a big driver for intestinal issues, gastrointestinal problems, gut-brain axis issues, and constipation. There's many variables we could look at today, but this is one I thought it'd be interesting because we will be doing episodes on sugar coming up in the near future. This slide here, if you see it visually, is about sugar-sweetened beverage consumption. And there are articles, research studies that have found people that consume higher amounts of sugar-sweetened beverages may actually be dealing with higher levels of constipation. I've done a lot of work in the area of sugar-sweetened beverages, and I feel very safe saying this. These kind of beverages are a threat to human brain health and human body health. And I just wanted to plant the seeds because we'll have some episodes coming up on sugar. But this slide here really highlights, why do we want to care about sugar intake? Well, the research does indicate excessive sugar consumption is associated with higher rates of obesity, type 2 diabetes, cardiovascular disease in some cases. It can have an adverse impact on brain health, behavioral functioning. It could be a factor in poor self-regulation. So really learning about the topic of excessive sugar consumption, regardless of what field you're in, I think it is another layer, another variable to be aware of that could be contributing to poor health outcomes in some of your clients. And this slide here, just to plant the seeds about excessive sugar consumption, if you see this here, and I'll go through it line by line, there have been studies that have found that excessive sugar consumption, this is consuming lots and lots of sugar over a long period of time, has been linked with poor brain health. It may contribute to inattentiveness, more memory problems. It can adversely impact our hippocampus. It may be a contributor for more learning problems and academic performance issues. There's a study or two that have found that excessive sugar consumption may contribute to more mathematical difficulties in kids. It can adversely impact our nervous system, and it can play a role in contributing to maladaptive neuroplasticity. And this slide here, again, sums up kind of some of the things we'd want to be aware of when we're talking about constipation and potential contributors. Constipation, functional constipation, it's a common gastrointestinal problem. What we eat plays a huge role. How much and what we drink plays a role. How much exercise that we get plays a role in combating this. And do we live a sedentary lifestyle? That's a contributor. And it is influenced by multiple other factors, and chronic constipation can adversely impact psychological well-being on top of physical well-being. Our last section today is all about tips, strategies, solutions, and interventions. Well, needless to say, like all of these topics we're talking about, I'm a major fan of looking at it from a holistic lens, a multidisciplinary informed lens, a biopsychosocial informed lens, and the research supports this. The management of gastrointestinal symptoms, including constipation, truly needs a holistic approach. When we talk about this specifically within the context of childhood constipation, this is a very nice article that was published in 2015 that also highlights when we're really trying to combat this in children, there truly is a need for a multidisciplinary approach. What would that consist of? Well, you're working with medical providers. Maybe you're working with a behavioral health specialist. Maybe you are working with a nutritionist, a sleep specialist, and the list goes on. Targeting these things from a multidisciplinary lens likely leads to better outcomes than targeting it from only one discipline. And a big part of constipation management and hopefully future prevention is really focusing on improved lifestyle practices, which would encompass what we eat. So another good reminder why we want to work with a nutritionist dietitian, capitalizing on sleep health, physical activity interventions, and I love lifestyle medicine approaches. That is a great way to really target problematic lifestyle behaviors. We're not going to get in the weeds with dietary recommendations per se in this episode, but some of the research does indicate, obviously, eating healthier foods, trying to stay away from processed foods, trying to stay away from foods that fall under the Western diet, eating foods that maybe more fall under the umbrella of the Mediterranean diet, making sure you have plenty of water every day. Obviously, that would be different for infants. You'd want to obviously work with pediatricians and things of that nature. But again, this slide here is just another reminder why it's so important when we're working holistically with clients to really consider consulting with nutritionists and dietitians as well. Here's some other interventions to be aware of. In some cases, depending on the age of the client, maybe you're working only with the family. Psychotherapy can be very helpful. Maybe there's some anxiety and depression going on. Biofeedback could be an option. There's some good articles that talk about the use of biofeedback as a way in which to address constipation. So if you're a therapist listening to this, learning about constipation, providing general psychoeducation to your clients on this, to the families you serve, might be helpful when you have the proper training and credentials, of course. Family education is so important again. Remember those lifestyle factors. Remember the importance of truly digging into that family system. The more we can provide families and children, when appropriate, with a psychoeducation around some of these topics, that in and of itself is an intervention. And this slide here again just sums it up, and you're going to find multiple studies in the constipation literature that really talk about maintaining proper hydration for management of constipation. Again, if we're talking young children, you wouldn't typically give a newborn baby a bunch of water. You'd want to talk to the pediatrician, being aware of that. We also want to be aware of not overdoing it with water, because we can have electrolyte imbalances. Maybe you're working with clients with traumatic brain injuries. We really want to be aware of sodium levels and electrolyte levels and things of that nature. And that is why it's so important when we're talking about this holistically and through a multidisciplinary formed approach. Stay in your wheelhouse, stay in your lane in terms of your competencies, and really focus on what you do from your behavioral health lens maybe. But then also the importance of truly directing their clients back to their healthcare provider, especially when you're working with clients with complex neurological issues and other kinds of chronic health conditions. This here, just another intervention. There's many interventions out there, but this one here, just a good reminder, the more we can help enhance self-efficacy in the people we serve, then if that client has higher levels of self-efficacy, they believe in their abilities more. They're more confident. The more confident they are, typically their self-esteem is higher. There's a direct connection between low self-efficacy levels and lower levels of self-esteem in relation to constipation as well. And as we get ready to wrap up, there are many more interventions to be aware of, but ending on a positive note, the more I think we can live a balanced, healthy lifestyle, really looking at it through a biopsychosocial lens, a lifestyle medicine lens, and we're practicing good self-care strategies, really focusing on eating healthy, getting good sleep, reducing screen time exposure, getting the proper exercise and movement, being around positive people, finding purpose in life. This is good for the entire brain and body, and it likely probably plays a role in combating constipation. Appreciate all of you. Here's my email address. Reach out anytime. We'll look forward to having you back to our next episode.
We hope today's episode provided you with valuable insights into the gut-brain connection and its impact across diverse settings. If you enjoyed this episode, please subscribe and share. For more information on this topic, resources, and services, visit pathwayscounselingcenter.org. Thank you for joining us on the Psychogastroenterologist, where mental health and digestive science converge.